Toddlers live a pretty rough and tumble life, but imagine having to be constantly on guard as a parent because the slightest bump or bruise could trigger hard to control bleeding. That was the life for the Hogans, whose young son has hemophilia. But as the Fox Medical Team's Beth Galvin explains now, the first child in Georgia to test a new treatment to prevent dangerous bleeds.
Goldfish.
Visits here to Children's Healthcare of Atlanta are a family affair for Jackie and Greg Hogan and their 3 boys, and Patrick, the youngest, is the patient.
Patrick is wild, funny.
He's sweet too.
The 4-year-old, diagnosed as a newborn with a severe form of hemophilia A, has a port in his chest to receive medication, and he used to wear a helmet almost constantly because, as his parents soon learned, the slightest bump or bruise could trigger dangerous internal bleeding in Patrick.
He hit his head and it was the size of a softball.
My mom sewed pads in all of his pants and with the helmet, and we had gates all over our house to kind of just keep him in safe zones.
The Hogans learned to give Patrick regular infusions at home of a medication that would help his blood clot. But then his body developed an inhibitor that blocked that medicine, making bleeds much more difficult to stop.
Unfortunately, kids with inhibitors can develop what we call spontaneous bleeding events, in which they can just spontaneously bleed into their abdomen, into organs, and into their brain.
All right, it's doctor's turn.
Dr. Robert Sidonio is a hemophilia specialist at Children's Healthcare and a paid scientific advisor to the drug maker Genentech. And he's part of a clinical trial called the Haven 2 to test a new drug, amicizumab, designed to reduce the number of dangerous bleeding episodes in some hemophiliacs. And Patrick is the first child in Georgia to receive the drug as part of this trial.
And it's a quick stick in the thigh and it's over. And we're done for the week.
But you also hold your breath, you know,
Yeah.
It's like, because there's claims and then there's like, it's a clinical trial, which can be a little bit scary for a kid.
But after nearly a year on the treatment, Patrick's bleeds have almost stopped.
These kids were often developing up to 20 to 30 bleeds a year, and with the drug are having as little as 0 to 1 to 2 bleeds a year.
Which means that the Hogans can finally relax and let Patrick play like the kid he is.
When he falls now, it's not, I'm running, I'm checking, okay, is this an ER visit or not? That's not the case anymore. He falls, okay, you fell, let's get up.
Beth Galvin for the Fox Medical Team.
Just over 100 children have joined the Haven 2 clinical trial. Because of the results of an earlier trial, the FDA has approved the drug for children and adults with hemophilia with inhibitors.